Hi, I'm Andrea Lapomi, and this is video 5 in a series for Ethics Mini Roles and Boundaries. Ethics Mini Roles and Boundaries is a massage therapy continuing education course that focuses on NCB TMB Standard 5. You can go to confidentmassage.com to find payment instructions, quiz instructions, and to download the companion text to this video series. Client decisions. In his or her professional role, the certificant or applicant for certification shall acknowledge and respect the client's freedom of choice in the therapeutic session. And that's from the NCB TMB Standards of Practice. Regular or decaf, hot or iced, tall or Trenta. Can you tell I'm writing this at Starbucks? We like having choices because we like to get what we want. We like to get results. We like to feel satisfied. We like to feel good. We need to remember that good is subjective and goals are specific. This means that taking a one-size-fits-all approach in the treatment room usually isn't our best course of action. Some clients respond best to light, soothing massage techniques, while others respond best to deeper or more rigorous modalities. As massage therapists, it's our responsibility to encourage honest communication between our clients and ourselves, and to listen to what our clients are telling us. Over the years, I've had massage therapists massage my abdomen after I specifically requested that they avoid the area. I've had a massage therapist deliberately touch a scab on my knee immediately after I told him to avoid the area. I've had massage therapists perform stretching techniques during my massage after I'd specifically requested no stretching. The thing is, I think I'm a pretty good communicator and easygoing massage client. I will tell you what I want you to work on, I will tell you what I don't want you to work on, and I'll say it all with a smile. The only way I could make your job any easier would be to undergo neck-to-toe laser hair removal so your lovely massage therapist mitts wouldn't have to deal with my stubborn Sicilian body hair. As long as we are capable of performing our clients' requested work in a professional manner, assuming their requested work does not violate our professional ethics, common sense, company policy, or clients' contraindications or the law, we ought to respect their wishes and give them the work they feel good about receiving. If for any reason we are unable to provide the requested work, perhaps we haven't been trained in deep glute work or hot stone massage, for example, we ought to politely explain the situation. If appropriate, we can refer this client to a qualified professional. Just don't violate your own professional ethics by performing work you are not qualified to perform. And never, ever ignore or dismiss what your client has to say in regard to their own personal massage preferences. So, sometimes our ego joins us in the massage room and we think we know what's best for our client, even though they communicated the complete opposite to us. Please respect what they say. They aren't saying it just to hear themselves talk. They're saying it because that time with you is sacred and that time with you is important to them and they want to get the most out of that time. And not only is it, does it destroy trust or create a less than safe feeling or atmosphere for a client when they feel that they haven't been listened to, they haven't been heard, and what they have to say hasn't been respected, but it's a source of stress. And massage therapists every day lose clients because massage therapists don't always listen. So awareness, again, we were talking about awareness earlier in this course. Awareness is key. Respect is key. Open, honest communication is key. Yes, there are tons of massage therapists out there who, it's kind of like a joke or a cliche. Oh, what do you think about for an hour while you're massaging a client? Are you making your shopping list in your head? And although sure, our minds wander, we're human, that's normal. If it didn't happen, we'd start to wonder, but a good massage therapist will be present and in the moment as much as humanly possible during a session. We don't want to phone it in. We don't want to go into autopilot mode. We certainly don't want that. I think clients can tell when we're on autopilot. So you want to be aware, you want to be present. You truly want to be sharing space with your client, not only physically, but also mentally. And, you know, sometimes when we are distracted, a client could say, you know, don't, you know, please don't massage my left big toe because yesterday I ran into the dresser with it. And it's usually part of your massage to massage your client's left big toe. And if you are not mentally present with them, there's a good chance you could go on autopilot just a little bit without even realizing it and accidentally start working on that toe. And your client might not even say anything, or they might. Either way is awkward. They say something and then you feel terrible and you're like, oh man, like, was the trust destroyed? You know, and then you apologize, of course, and you know, hopefully everything will be okay and you'll be forgiven. However, you can't guarantee that. And if your client doesn't say something, again, they're going to feel that they weren't heard. They're going to feel that they weren't respected. They're going to feel like their request or their well-being wasn't your number one priority. And obviously it should be. They're coming to you for a wellness service. And again, it can serve as a source of stress. If they don't say anything, it could also, and then you realize later what you did. Again, that's a source of stress for you. Now you're going to be worrying about it. Now, you know, the time has passed. You're probably not going to call them up. Oh, Jim, I'm so sorry. I touched your toe 2 hours ago. But you're probably going to want to. You're probably going to be tempted to. So yeah, awareness and being present. Because your client they're not only paying you for the physical act of touch, they're paying you for a complete experience. You are creating a total environment for them. You are creating a place, you know, if you specialize in relaxation massage, you're creating a space for them to just forget about the stress of life for their time with you. So, and yes, just to touch on educating our clients, clear and honest communication. Again, we don't want to step outside of our comfort zone. We are not, unless we have something prearranged with a client that they are going to be a guinea pig, we do not need our unsuspecting, full price paying clients to be our guinea pigs if we are not feeling confident about a certain technique or modality. So communicate with your clients and welcome the fact that they want to communicate with you and honor that. Which leads us to the next chapter, session refusal. In his or her professional role, the certificant or applicant for certification shall respect the client's right to refuse the therapeutic session or any part of the therapeutic session. And that's from the NCB-TMB Standards of Practice. Just as massage clients have the right to choose the type of massage therapy they'd prefer to receive, they also have the right to refuse a session, in full or in part, at any point in time. Maybe your client is suffering from sinus congestion and they just can't get comfortable on the table, or they're going through an emotional rough patch right now and they just can't relax at this moment. Perhaps your qualifications aren't a good match for the type of treatment this client is looking for. Or for whatever reason, they don't feel entirely comfortable entering into or continuing a session with you. And although having your client verbalize a reason for discontinuation of a session is ideal, technically your client doesn't have to give you a reason. They have the right of session refusal, no reason given. Although session refusal is a client's right, it's rarely a source of knee-slapping entertainment for either party involved. In an effort to minimize the occurrence of massage session cancellation or discontinuation, we ought to employ top-notch communication skills at all times. When a client books an appointment, are we clear on the type of service they're looking for? Do we offer comprehensive descriptions of the services we offer? Are we honest about our limitations? Do we respect our clients' requests and boundaries? Are we doing everything we can to help our clients feel comfortable, safe, and valued in our presence? There may be times when a client feels the need to cut a massage session short, no matter how diligent we are in our efforts to be the most communicative massage therapist in the entire world. This can be hard to swallow, but we shouldn't take it personally. Again, taking things personally. Let's not do that. Sometimes people don't want to divulge that they're on the verge of suffering a panic attack, about to experience an urgent bathroom situation, or the fact that they're just a very unpleasant individual with a personality only a taxidermy dog could love. And yes, we are going to encounter clients like that from time to time. Thankfully, they are the minority, but sometimes there will be just like clients that just ooze negativity, and for whatever reason, and we view them with compassion, but we don't want to find ourselves in a situation where we're feeling emotionally abused by them. But sometimes you will get a negative client on your table, and if they want to end the session for whatever their reason is, that's their right. If a client chooses to discontinue a session, remain polite and professional while you accommodate their request. You do have the right to ask why. Again, asking why is a good habit to be in, and to ask if there's anything you can do to make your client more comfortable. Just don't get upset if they refuse to give an answer, or if they decline your well-intentioned assistance. You'll probably realize in the long run that you dodged a bullet when they left your treatment room post-haste. So yes, even if you have a client, a regular client, somebody that you have a great professional relationship with, and we all get sick sometimes. We all eat the bad clams. Oh Lord, have I eaten enough bad clams in my life? No more clams. But we all have we all find ourselves in situations where our bodily functions are just out of our control. And you know, do you really want somebody on your table for 60 minutes or 30 minutes or however far into the session you are by the time they terminate the session? Do you want them on your table just like clenching and breaking out in a cold sweat? No. They don't want that, and you don't want that. As far as charging for a refused or discontinued session goes, it's completely up to you to make the right call. If this client was aware of your cancellation policy at the time of booking, you do have a leg to stand on if you decide to charge them. On the flip side, if this is a regular, loyal client who is suffering from a one-time malady of some sort, it will probably benefit both of you to waive your cancellation fee. Again, trust your boundaries and assess these hopefully rare situations on a case-by-case basis. And of course, this will depend also on what kind of business arrangement you have. If you're a solo practitioner with your own clients and you don't answer to anybody and nobody answers to you, you have typically you have a lot more control over how you want to handle these situations. If you work at a large spa and there's management in place and you're hired as a massage therapist, then the spa has a policy, and that's the policy that will be followed. And typically in that case, it's the receptionist's responsibility or management's responsibility to handle the payment situation or the cancellation fee situation with those individuals. So that it will depend on your situation. Okay, we have a few questions regarding this chapter. I have a client who is currently pregnant. When she's not pregnant, she's very reliable and always shows up on time for every massage. However, now she often arrives 15 to 20 minutes late and has even canceled last minute twice. I understand she's facing some challenges right now, but I'm not sure what to do. So it sounds like this client is actually a lovely client. Somebody that you want to keep happy, somebody that you'd like to have continue to come back to see you. And even if she's not feeling the massage while she's pregnant, or whatever her reason is for showing up late and canceling. I don't know what that is exactly, but you know, after she has the baby, she's probably gonna need those massages twice as much. So so our goal here is we want to preserve this relationship with this client because she sounds lovely, and it sounds like she is going through a you know, a trying time here with her situation. So you're probably going to want to have a conversation with her where, you know, you express that you have noticed that, you know, in the past she's like never canceled and always shown up on time or early for her appointments, and that you've noticed that, you know, things are unfolding very differently now. And, you know, what's going on? Like, what, you know, oh, I noticed that you canceled a couple appointments within the last few months, and you know, that sometimes when your 10 o'clock appointment, you're not getting here until like 10:15, 10:20. What's going on with that? And maybe it's a matter of she has, you know, doctor appointments. She schedules doctor appointments in the morning, and they're taking longer than she thinks they're going to take. So maybe she's running late getting to her appointment, or maybe they go so late that she cancels the appointment because by the time she leaves the doctor's office, her appointment time would be over anyway. It could be something simple like that. If it's a health-related issue, you know, then I'd certainly encourage her to talk to her doctor about any health-related issues that may be impacting her quality of life. So I think you need to have an open and honest conversation with her about what's going on with her before you know, drop the hammer and start going off about your cancellation policy. That being said, if you feel that you two have tried to remedy the situation as much as possible, she's now, you know, you're now scheduling her at noon instead of 10 a.m. So there's a large chunk of buffer time between whatever the task is that's making her late and her appointment start time. If you two have tried to work through that and it's still an issue, then that's when your cancellation policy is going to be a good friend to you. Make sure your cancellation policy, you know, leading up to that, like now, make sure your cancellation policy is clearly explained on your website. Make sure if there are any updates that need to be made, make sure you make those. Make sure that you make those publicly so people can easily find them. And it may even be worth sending out, let's say, a client newsletter, you know, to your email list or however you communicate with your clients, Facebook, whatever it is, just bringing attention to the fact that this is your cancellation policy, or bringing attention to the fact that you've just updated your cancellation policy. Sometimes that's all it takes. So you've got options, and I think, and whatever happens, I think you'll be able to maintain a very happy, healthy, productive relationship with this client going forward. And I hope everything works out. So thanks for your question. All right, we have another question here. I injured my thumb, tendon issues, no open wounds. Sorry, you injured your thumb. But thanks for making it clear that there were no open wounds, and have had to alter my massage techniques. I have a few clients who love thumb work on their necks and feet. Should I tell them before they come in for their next appointments? It's funny, I've found myself in a similar situation once. I too had like an inflammatory issue. It was a while ago and it's better now, but in my thumb. And I had to give it a rest so that it could heal, like so many overuse injuries. And I was able to alter my massage techniques for 99% of my clients so that they didn't even miss the fact that I wasn't able to use my right thumb anymore for that period of time. That being said, I did at the time have a client that was very similar to your client, and deep footwork, like he needed a lot of work in his arches. And you know, I tried other things. I tried different tools. I tried you know, like a cap that goes over the thumb to kind of brace it. And those were okay, but I didn't feel like the results were as good as they were when I was just, you know, using skin to skin thumb techniques. So I did communicate with him and I let him know, hey, I'm recovering from a thumb injury. I know the kind of work that you enjoy receiving, and I want to be able to continue to give you that level of beneficial work. I just need you to know right now, you know, we're going to have to use this tool, or we're going to have to use this technique. Or are you okay with that? And if you're not, I can try to find another massage therapist who may be better able to perform the techniques that we've used in the past. So referring out is an option. Most times your clients who you have a relationship with, they are going to appreciate your honesty. They're probably going to actually feel a little bit bad for you. You can reassure them that it wasn't them that caused this injury, and they're probably going to stick with you. You know, there's really not a lot to be afraid of there. They're probably going to stick with you. And again, you can always refer them to a trusted professional. And I hope you get better. And I know, personally speaking, this is kind of like a side note, I became much more aware of my body mechanics and overuse tendencies that I had. So I don't have those thumb issues anymore because I, you know, gave me an opportunity to kind of, again, hit the reset button and straighten out my boundaries and use my head a little bit. So, because again, we are in control in the massage room. We call the shots, and if adjustments need to be made to keep us happy and healthy and to help our career longevity, then it's our responsibility to take control and to make those things happen for us. So, all right, I will see you in the next video. Again, you can go to confidentmassage.com for payment instructions, quiz instructions, and the downloadable text that corresponds with this video series. And again, if you have any questions, you can reach me at helpinghands@confidentmassage.com. Thank you.